Right. Hi, everyone. Thanks for joining us today. I'm just going to go over a few housekeeping things, and then I will jump into everything you need to know to apply and be funded for a Mobilize grant. So this session today is a webinar format. So if you have any questions as I am going, you can put them in the chat box or the Q&A box. If I see the questions as I'm going, I might stop and answer them, but otherwise I will get to all of them at the end of the session. And just before I start, I want to take a moment to acknowledge that here in Saskatoon, I'm on Treaty 6 territory and the homeland of the Métis. So today we are here to talk about SHRF's Mobilize grant. So I'm Chelsea Cunningham. I'm the Programs and Engagement Manager. So I'm the manager for this grant specifically. So as you're working on an application, if you have any questions at all, I'm the one to ask. And so for this session today, I'm going to go over a bit about who SHRF is and what we do, what the Mobilize grant is, how or who you can apply, also how you apply, and some key takeaways to help you with your applications, hopefully be successful. And then I will open the floor to any questions anyone has. So first, who is SHRF? So the Saskatchewan Health Research Foundation is the provincial agency that funds, supports, promotes the impact of health research that matters to Saskatchewan. And we do this through our 3 strategic goals. So that is to strengthen research capacity and competitiveness within the province, to increase investment in research and innovation, and to align research with stakeholders' needs. And we carry out these 3 strategic goals through our programs. So our programs are designed to address the strategic goals in different ways by investing in both health research and in knowledge mobilization. So we have 4 umbrellas that we design our funding opportunities under. And so excellence, relevance, and potential for impact are central to the criteria for all the umbrellas. But today we're here talking about the Connections program, which also focuses on knowledge mobilization and engagement. And then specifically the Mobilize grant. So what is the Mobilize grant? It is a new grant. This is the first time we are offering it at SHRF. It is replacing the Research Connections grant that we used to offer. So you'll see some things are the same, but there are some differences to make sure you make note of when putting together an application. So the purpose of the Mobilize grant is to fund knowledge mobilization activities in relevant and practical settings and mediums. And the overall aim of any application should be to improve the applicability and impact of health research in Saskatchewan. So this really means we want to see research meeting people where they are at. So for this opportunity, we use knowledge mobilization to refer to activities that bring awareness to research activities and findings in a way that can be used in practice. And so activities that can be encompassed within this include, but are not limited to, knowledge synthesis, dissemination, transfer, exchange, and co-creation or co-production. A little bit more about knowledge mobilization. So we want to see that this encourages exchanges between researchers and knowledge users. And knowledge users we use to refer to any individual who can receive and use new knowledge to implement improvements in health. So whether that's their own health, their patient's health, their community's health, etc. So I have some examples there of who knowledge users could be. So it's a very broad group. So we have healthcare providers, health system managers, policymakers, educators, healthcare administration, community leaders, government, basically a limitless group. If they are able to take your research knowledge and use it to implement change, they are probably a knowledge user. And so for this grant, there are 3 objectives that we use to identify if the grant is meeting the program purpose. So applications should clearly meet one of these objectives in order to be considered for funding. So these objectives are meant to support the exchange of knowledge with researchers and knowledge users in different directions. So the first objective we have to facilitate the use and integration of health research knowledge and evidence into practice and decision making. So you're taking research from the researchers and providing it to knowledge users to use. For the second objective, we have facilitate the use of relevant knowledge, for example, lived experiences, traditional knowledge, to inform and guide research activities. So that's taking knowledge from your knowledge users, incorporating into the research so that it's hopefully more relevant to them later on. And for the third objective, we have to facilitate the participation of non-academic team members in the research and knowledge sharing process. So you will notice these grant objectives do not encompass knowledge sharing between academic or researcher groups. So these are not considered eligible for this funding opportunity. And you might notice that these objectives are fairly broad, especially compared to some of SHRF's other grants. So only one of these objectives needs to be met, and there's no minimum team requirements. The idea for this grant is we really just want to push the research community to get creative in ways you can share your research and build impact through the maybe less typical means. So a few funding details about this grant. The value, you can ask for up to $10,000 for up to a 1-year term. SHRF's extension policy is the same as for other grants. So 1-year extensions are very easy to get. And there's not usually a limit on the extensions as long as there's a reason or a delay that's out of your control that you can show us. We also change from Research Connections. There is no matching funding required. But there are a few other points I'll address later that we need to see in applications that's kind of replacing the matching funding requirement. And for the timeline, we do have 2 intakes planned for the fiscal year. So this first deadline will be July 11th, and that would be a funding start date of August 1st. Or if you're not ready for the July 11th deadline, we will have another deadline, February 14th, with the funding start date of March 1st. And so a couple notes, it is 1 application per principal applicant per intake, but you can apply to both intakes if you would like. But keep in mind when we're reviewing, we do have record of your past grants. So it should be building upon the previous application or exploring a new area. And deadlines are always 4:30 p.m. Saskatchewan time. And so we'll get into who can apply. So this will cover the things like eligibility, team requirements, and the application requirements themselves. So eligibility. The eligibility principal applicant requirements are slightly different from your other SHRF peer-reviewed grants. So for this Mobilize grant, the principal applicant must reside and work in Saskatchewan throughout the funding period. They must not be a trainee, and they must agree to adhere to all SHRF funding policies and reporting requirements. And so as part of that agreement to our funding policies and reporting, they have to either have a position at an institution that has a memorandum of understanding with SHRF, or be employed by an organization in Saskatchewan with an interest in health research and knowledge mobilization that is eligible to administer grant funding. And by eligible to administer grant funding, we essentially mean that they are a CRA qualified charity. And so they have to be able to provide that statement of account to SHRF. On the side here, I just have the logos of all our institutions that have an MOU in case you're not familiar. And then, so that was for the principal applicant requirements. For the application, there's a few things that we want to see within the applications for them to be eligible. So they should clearly foster knowledge mobilization in relevant and practical non-academic settings, and then within Saskatchewan, of course. They should be based in legitimate and vetted research, and they should address a gap in current knowledge or practice. We want to see that the knowledge users and the audience of the activity are identified and they have a role in the application. We also want to see that the methods are useful and accessible for the target audience and provide concrete deliverables. As applicable, they should use resources and provide employment and training within Saskatchewan. If there's no employment needed for the activity, that's okay. Just that if that's something the application is using, it should try to be within Saskatchewan as much as possible. And we also want to see that applications include an evaluation plan. So I will just note with these application requirements that this grant isn't generally for generating knowledge, i.e. research activities. So anything associated with actual data collection, etc., would be considered ineligible expenses. And then for the team requirements, as I mentioned before, there's no minimum team requirement, but that's not really to suggest that you won't need a team on your application. Because this is focusing on exchanges between researchers and knowledge users, it would be hard to assess a grant that has no team on it and see the feasibility of it. We want to see that you're able to meet your audience where they're at and have at least somewhat of a relationship or a plan to build that relationship in place. So to that end is my statement here on the slide, that the application should demonstrate engagement or potential to engage knowledge users and the target audience. But we are quite flexible on how you show that. So whether that's you have some matching funding from them or in-kind resources, there's still space on the application to list those. We also look at letters of support, specifically identifying how the proposed project will benefit the audience or the knowledge users. This could be, we could have co-applicants who are the knowledge users or people with lived experience. There could also be a detailed project plan describing how the audience will be successfully engaged within the timeline, or anything else relevant that maybe we haven't thought of, but you are able to do. Just making sure that it's evident within your application is important. And so one of the easiest, I don't know if I should say easiest, one way to show that you have this engagement is through having people on your team within these roles. So I'm going to go a bit into what the project team roles on our applications can look like and who would fit within these roles. So people on your team would fall into one of three categories. So we have co-applicants. Those are the people that are contributing to the intellectual, cultural, or scientific direction of the project. And these come with three descriptors, we call them, on the RMS system. So that's your researchers, your knowledge users, and your people with lived experience. And I'll go a little bit more into detail about those three descriptors in a minute. Another role is personnel. So that's anyone who's there to carry out aspects of the project. trainees, research staff, etc. So this role can be compensated from grant funds. And then finally, we have the supporters who are supportive of the research, your maybe collaborators that are interested in the project and the outcomes, but maybe have less of a role carrying out the activity than your co-applicants. And I should note for the Mobilize grant, there are no contribution forms. If you've applied for other SHRF grants, you're probably familiar with those. So the only thing required for team members on the Mobilize grant is to have access to an email to accept the invitation that indicates that they are a part of the grant. There's no additional form that they need to fill out, any information about themselves, CVs, etc. None of that is a requirement here. And we do have an option. If email access is an issue, there is a form that can be completed to indicate a person has given the principal applicant permission to accept the invitation on their behalf. And so these co-applicant descriptors, as a general note, co-applicants can't be compensated from grant funds, but there are some exceptions for knowledge users in way of time release and for people with lived experience in the way of honoraria. As I mentioned, there's no CVs for this because there's no contribution form for your team members to complete. But as part of the application package, the principal applicant should provide a document about the role and background of each team member. Just a very brief explanation for everyone so that we can see what their role is on the grant and why they are qualified for that role. And then I have the descriptors here across the bottom. So the researchers are any individuals with formal training and that hold a position that supports them to pursue research. The knowledge users, as I kind of went through already, those are any individuals interested in the applications of the knowledge generated from your research. And the people with lived experience, these are individuals who support the project through their personal experience with a health issue or experience as an informal caregiver. And there will be some overlap between your co-applicants and your supporters. So that's the ones on the previous slide that are interested in the outcomes of research, but maybe playing a less active role throughout the activity. But we recognize there's a bit of a spectrum there. You can kind of determine the best fit for your unique team. If they're really heavily involved in part of the team, providing input, feedback, guidance, if their role is critical for the project to be successful, they would be considered a co-applicant probably. If they're more of a collaborator that's supportive of the outcomes, but their role will come in kind of more later on and sharing these outcomes of the project, that might be someone who would be considered a supporter. A couple more things just in terms of eligible applications. We also look at the allowable expenses. So SHRF is publicly funded. So we do look that any expenses are fiscally responsible and there's accountability there. And then all expenses should be clearly justified in relation to the proposed project and cover only the direct costs. So things like operating costs, overhead costs are not typically something that's allowed. And then specifically a few not allowable expenses would be things like equipment and academic dissemination. Journal publishing fees are not eligible. We also don't cover grant writing activities. And the SHRF funding guide has policies that apply to allowable expenses for all SHRF programs if you have any questions. And I also had a note to mention that your budget should match the proposal so we can see why the expenses are needed. And if there's any quotes that you're able to provide, that helps as well. All right, and then we'll get into how you apply. So that was all the information about if your application would be eligible. So assuming you've gone through that information, your project fits all requirements, how do you get that application in? So our application process uses SHRF's research management system, or RMS as we refer to it. And then the links there, everyone who registered for this session, I will be sending these slides around, so you'll be able to get a hold of these links. And then we also have a number of application support resources. Most importantly, the Mobilize application package, which is found on our website. But then also, as I mentioned, the SHRF funding guide, those are the policies that apply to all SHRF grants. If there's any exceptions for Mobilize to funding guide policies, that will be specified within the application package. So example of that is the principal applicant requirements. The Mobilize application package is different than the funding guide, so refer to the Mobilize application package on that one. And then we also have a SHRF RMS manual in case you need help navigating the system. So first thing, you'll need an RMS account in order to create an application. So when you follow that link to our RMS, there's a register button if you're new to the system. If you already have an account, you just log in as normal. But specifically for those that are new to our RMS system, when you are registering, if you are the principal applicant, in order to be able to apply, your affiliation will have to be a SHRF MOU research organization or a CRA registered charity. In either of those categories, you look up your organization by name or registration number, select that, and then complete the rest of the process. For your team members, they can choose any of the organization options. If they are from a nonprofit that's not CRA registered, then they would fit under other organizations. If you are creating a new account and can't find your organization, or if you had a SHRF account but now need to change your organization, that's that you can contact Tanya at, the email is helpdesk@shrf.ca. I will have that contact information at the end of the slides as well. And then, yeah, once you have your RMS account, from there, you will be able to see any open opportunities, create the application, and just work through all the questions within the application, keeping in mind the application requirements. For the review process, the Mobilize grant is not peer reviewed, so it is an internal SHRF review committee with external reviewers as needed. The review criteria considers the grant objectives, all the application requirements, and the amount of funding that SHRF has available for this competition. So typically the demand for this type of funding has been quite proportional to the amount of funding SHRF has budgeted. But if application demand ever increases dramatically for some reason, we would have to prioritize applications based on alignment with SHRF strategic goals. The review process, we also, so we do have official review criteria set out in the application package that I will go through on the next slide. And we do provide the applications with review comments now, just to kind of give you an idea of if an application was not deemed eligible, why that was. If it wasn't funded for any other reason, we kind of provide some feedback. And the hopes of this is kind of to build a little bit more of this knowledge mobilization capacity. So our review criteria, we look at the quality of the proposal. So that's, are your objectives and outcomes clear, that we can identify them? Is the application embodying the purpose of the Mobilize grant specifically? The review criteria are quite a bit longer than what I have on this slide. You can find those in the application package for all the points under each of these 3 headings. We also look at engagement. So that's about, can we see that your knowledge users and audience are clearly identified? Are the proposed activities relevant and accessible to them? Is there evidence of resources required to complete the project? So if your project requires buy-in from healthcare practitioners to share a flyer or something, do you have one of them on the team to show that they are supportive of this? Do you have a plan of how you will approach them and convince them to do this? Things like that. And finally, for the outcomes and impact, we're looking at if the proposed project has the potential for impact on health outcomes through influence of practice or policy. Is there a clear and appropriate evaluation plan, including information on how the outcomes and impacts will be measured? Especially with the impacts, obviously a lot of the longer term big impacts are very hard to measure. If something, knowing this information will improve health, but the payoff might be a bit longer term. Even if you have anything in the shorter term to show, that can really help us see that there is an evaluation plan in place. So a couple key takeaways that I think are very important for making sure your application can be funded. So first, the academic knowledge sharing isn't eligible under this funding opportunity, just a reminder on that. And the application must show involvement of knowledge users, but it is flexible to meet this requirement. So as I kind of went through on that one slide, there's no matching funding, but show us that you have involvement of knowledge users in some form. Show us that they're invested in this project and they will care what the outcomes are. Also, show us who your team is and how they contribute to the project's success. So if you're able to add them as co-applicants or get a letter of support or just use that roles and responsibilities one-page document to really show us how they're contributing to the project. Also include a feasible evaluation plan. As I was kind of talking on that last slide, like the large impacts might not be directly measurable, but what could you measure in the interim to show that the activity itself was successful and is set up to have those larger impacts later on. And this one's more of an application tip, but focus your rationale on why the activity meets a need or addresses a gap, rather than on why a health issue is important. So kind of my main example of this, having a cancer research background, is everyone knows cancer is bad. So focus more on why, like what we are doing to address a gap that exists, rather than why the health issue is important. And then finally, your application will be reviewed by non-experts. So kind of try to adjust your terminology accordingly. If there's a lot of acronyms and very field-specific terms, we might struggle to really get the picture of what you're trying to get. Our internal review committee does a very good job. We've seen many, many different types of applications over the years. So sometimes it takes us a little longer, but we can usually get on board with what you're trying to tell us. But the easier it is for us to read, the easier it is for us to review. And that obviously helps you in the long term. So that's my key takeaways from this session. For contact information, my contact information here is on the slide. I also have the contact information for Tanya, who is there to help you with anything you need in the research management system or the application form itself. Her email is there, or you can also email helpdesk@shrf.ca to reach her. And I also have a few other links that will be in the slides when I send them. So as I mentioned, there's the funding guide and RMS manual. We also have a number of RMS how-to videos. So if you're struggling, say, to fill out that RMS profile, there's a video that will walk you through the steps to fill that out in real time on the system. And I'll just go back to my takeaway slide, and I will now look at the questions. So if you have any questions, you can throw them in the Q&A box or the chat box, and I will be monitoring both. So the first question that was asked was if I will be sharing these slides. So yes, I think I addressed this after you asked it. I forgot to address it right off the bat, but I will share these slides to everyone that was registered for this session. I'll be sticking around for a little while yet if any questions do come up. But if everything was clear, or then great. If you think of a question later on, you can email me anytime. I'll be here